You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says no one should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have the desert's go-to implant dentist, Dr. Kala Miller. Dr. Miller, welcome to the program.
Thank you, Randy.
Now, I know you brought some photos, but for people that don't know your practice, like who's the typical, if you had to say, a typical dental implant patient that you see?
Well, we have two sets of patients. One who's worn dentures for years and thinks that that's the only option they have. They have not gone to the dentist, only maybe 5 years later after they've had their dentures, and so when it's loose and they think they need to reline their denture. So they are not in tune with what the options they can have. For those people that don't have loose dentures today, they can leave with upper and lower teeth in their mouth.
Very nice. Now, what about those people that still have teeth, but it's been determined that they all have to be removed?
Yes. So the second set of patients are those who may have teeth, but their gums are infected, they're red, and their teeth are loose. So patients like that, we have an option for them too.
Okay.
We can take the necessary teeth out. We don't have to, I'm here to save teeth as much as possible.
Okay.
Because taking teeth out is expensive.
All right.
So we are going to do everything we can to save teeth. But those that we can't save, we have other options.
Okay.
And so we can take them out, clean up with the infection, place some implants, and they too can leave with teeth in their mouth, being able to chew, smile like they've never smiled before, have walk with confidence, and enjoy their life. And it doesn't matter if they are 52, 42, 62, or 92.
92? You can do this at 92? Why would a 92-year-old want to do this?
You don't get it. A 92-year-old, 62-year-old, they want to eat. They want to have a happy life. They want to date. They want to smile.
Okay.
They're retired. It's time for them to enjoy life. And if they don't have teeth, how are they going to enjoy life? How are they going to smile? How are they going to feel confident?
So they're not, I mean, statistically, they're not more likely to fall out if you're 92?
Not at all. Age is not what we decide on whether a patient needs implants or not. We have to check their bone. We've got to check their medical history. We have to know whether they're smokers. Those are things we have to take into consideration, not their age. And that is really good news, isn't it, Randy?
That is good.
There you go.
Now, I should also mention another thing. At your practice, and correct me if I'm wrong here, I guess how dental implants are typically done is you go to one place where they do the surgery and then another place where they put the teeth on top and then you get them maintained elsewhere. You do all three parts. Is that why you do it so quickly?
That is absolutely correct. Because that helps us to work as a team and cut short the time from start to finish for a patient to get their teeth and to be able to function.
But does it cost more to go to that, with that team approach?
In fact, it costs less. We know what the big guys are charging. We don't agree with their philosophy.
Okay.
But we certainly customize our care for the patient.
Okay.
So yes, it absolutely costs less in my office, and we are able to spend more time with the patient.
Okay.
And custom design our approach for them. And I think that's extremely important. Let me show you something. I bought a photo of my 92-year-old.
Okay. She's looking pretty good.
Well, when she first came into the office, her main complaint was, "Doctor, my front teeth look terrible and I want to know what you can do for me." Well, they did look terrible. They had holes, and I said, "What happened?" Well, she said she lived in a ranch and she just never thought about getting her dental work done. So it's always important for me to address that issue. So that's exactly what we did.
So that's what bothered her, was her front teeth.
That's exactly what bothered her, front teeth.
Okay.
And she just was very upset about it. So we addressed that. I reviewed her medical history. I noticed she was taking 7 medications. She had some health issues. So before I started, I said, "I'll be happy to fix that. It's going to work out. Let me call your medical doctor." So I had a personal conversation with her cardiologist, and he told me exactly what her conditions were. So after I got approval from a doctor, we started the work, and with a combination of procedures, she walked out with beautiful teeth.
This is her now.
Yes,
Okay.
and what a difference. She walked out smiling, confident, holding her bed. She looked like she was in her 60s. And she was so happy that when her daughter walked in to pick her up, her daughter was shocked and so happy to see her mom so happy. Now,
Is this the person you did an impression of in the green room, the way she walked in happy?
yes,
Okay.
exactly.
It's just teeth, so it's more than that. I'm not trying to be insensitive.
It's more
here.
than that, Randy. It gave her confidence, it gave her courage, it changed her whole life because she now wants to take further care of her health.
Okay.
And she wants to take supplements and she wants to be able to be more active. She's just a changed person, and that gave me so much happiness. But
Now-
here's the key,
yeah,
Randy.
Yeah.
I didn't change her life. She did, because she had the courage
a good
to
point.
saw my flyer
Nice.
and called my office and wanted help. So, those
Now, does she ever regret? Does she say, I should have done this years ago?
yes, she did. She said, I wish I had done this years ago.
How many years does, maybe not her, but I think you told me, people don't like their teeth for a long time. Like what about
She
this woman? Do you know?
struggled with this for over 20 years. What was happening in her teeth didn't happen overnight.
Okay.
It took a long time. But she just didn't think about getting it taken care of.
And in one day, it's done.
And then finally she came to the desert. She was retired. And then she said, you know what? It's time to get my teeth fixed. And she did it. And she's very happy.
Okay.
And so age isn't the issue.
So at the top of the show, we said no more dentures. Do you believe that? Whether it's 20 years from now or 100 years, dentures as we know them today won't exist. They'll all be attached to something?
Correct.
Do you believe that?
I do believe that, because that gives people such a difference in lifestyle. They can actually taste their food in their palate. They can taste the wine that they drink. And you know, wines come in different flavors. And a lot of our seniors love to taste different types of wine. They love to go to wine tasting. They love tasting cheese. They love dining out. Where I live, people like to dine Monday through Sunday. So they love enjoying, they love socializing. And when they socialize, they love to smile. And a lot of people refuse to go out all because of their teeth.
They tell you that.
They tell me that. And when it's turned around, they are so happy.
They're back.
They are back. And also their health feels better, because it does affect your immune system. You can eat better, you can chew
gum
better.
disease.
The gum disease. And
So
the
remove
fact,
the infection, they feel better.
of course,
Okay,
plus
okay.
they take time to chew before they gum their food. They just swallow their food, so they eat more than they should. But now they're able to chew, enjoy, take their time, and sort of eat and enjoy the flavor. And so they are able to swallow their food, they're able to digest their food better.
Okay.
And so they are much more healthy.
In the Coachella Valley,
Yes.
I mean, it's almost known for healthy people, healthy lifestyle.
yes.
People, a lot of people hiking and everything else. Are there really a lot of people that are either in a denture or headed to dentures over there?
There are tons of people. You could fill the McCollum Theater with dentures, people that wear dentures, or people who have gum disease and walking around with loose teeth, or maybe even the tennis garden. That's how many people there are today.
So thousands of people.
Thousands of people, and they think that's the only option
Well,
they have.
if it's so good, then why aren't they all doing it? Like, especially the denture wearers or people, why aren't they all coming in and getting new teeth with dental implants? What's your take? What's your opinion?
Well, I think there are about 4 or 5 major reasons.
Okay.
One, they have dentures, they haven't gone to the dentist in a long time. Or if they have loose teeth or gum disease, they're not in pain, but they know they're bleeding, so they think, well, I don't think I need to go. And some of them are scared. They think that if they go to the dentist, they're going to be in pain. And that's a very serious problem.
Okay.
But in our office, I want to assure you, we are very sensitive to that. And most of our patients leave with no pain or very little pain. Almost so.
I mean, everybody's numbed up.
Yes, everybody's numbed
You're
up.
using some sedation on most of these
Of course,
people.
and patients who are extremely apprehensive, we give them oral sedation. We can even give them IV sedation, and for that we have an anesthesiologist if you need it.
It's nice.
But most of my patients like oral sedation, and they recover fast, and the procedure went very well. They feel very little pain or very little discomfort. So
Can some of them even go after, let's say they get their new teeth supported by implants, could they take over-the-counter medications?
yes,
Do some
absolutely. In
actually do
fact,
that?
most of my patients, all I prescribe, the surgeon prescribes is over-the-counter medications.
Okay, that's nice.
And they have very little discomfort, very little swelling. We explain to them what they should do. They use ice. The third reason is they think that they're losing a lot of teeth, so they need a lot of implants, and it's going to cost them a lot of money. But today, we can offer them on the lower 4 implants, and on
4
the
implants for a full arch of teeth?
full arch of teeth on the lower.
Do they snap in and snap out,
There
or
are-
they stay in?
They can snap in and snap out, and if they want it to stay in, we can probably make it with 6 implants. And that's very, very reasonable to
Okay.
have a good set of teeth that never come out of your mouth, a full arch of teeth on the lower. On the upper, we can give them a snap in and snap out with 4 implants minimum.
Snap in, snap out set of teeth, like a
Yes,
like a denture that snaps in
snaps in
out.
and
Okay.
snaps out. It's shaped like a horseshoe, so they can feel their palate and they can taste their food,
Okay.
and they can smile. Or we can give them a fixed set of teeth with 6 to 8 implants.
Fix mean they don't come out.
They don't come out. Exactly. It
Okay.
stays in your mouth. They look like crowns. They can smile. They can feel their gums. They can chew.
They can eat anything.
They can eat anything.
What about things like biting a carrot with your front teeth when it's all healed up? Can they still do that, or they have to be careful?
They can, even with natural teeth, I don't advise people to bite a hard carrot, but they certainly can eat grated carrots. We can all eat grated carrots.
But they can eat like corn on the cob.
They
whatever.
can eat
Apple,
corn on the
they can bite an
cob. They
apple.
can
Okay.
they can slice their apples. They can slice their oranges and eat on them. They
Now-
can eat corn on the cob, popcorn.
But if you've been wearing a denture for, let's say, 10 years, is it true you can't do this? You don't have enough bone.
That's not true anymore, because today we have bone materials that we can use to strengthen your ridge. And I've had patients who've worn dentures all their life, and we've been giving them a full arch of teeth.
Like all their lives, how long? More than 10 years?
30 years, maybe even 40 years.
And still had enough
And
to get new
still
teeth.
had enough bone. We were able to give them implants and a beautiful full arch of teeth, and they're able to smile, and their whole lives have changed because they made the decision to inquire and come to me,
Nice.
and we were able to help them.
Now, you know, I'm paraphrasing you slightly. We've talked on the phone. In fact, when we first met on the phone, it's like you created a dream team. You say some of the top guys from UCLA, that all work there with you. Could you spend a few
Yes,
seconds on
I
that?
would like to tell you about our dream team. And what's really unique about our dream team is they are highly qualified doctors, one from U of Penn, #1 in the country, another from UCLA, 2 from UCLA. But what's unique about my dream team is 3 points. They are highly qualified, they care about my patient, care about you, and they are very kind and gentle when they do their work. And I
You
think
said they're
that's-
humble. What do you mean by that?
They are not egocentrical. It's not all about them. It's about you, the patient. We are here to serve you. And that is the difference.
Now, you've been practicing dentistry for a long time. Is this the happiest group of patients when you take somebody with no teeth or broken down teeth and give them new teeth supported by implants?
I think that's the greatest satisfaction you can have. When you come in and the patient is so depressed or, just feeling hopeless, they can't eat, they kind of stay in their home, they're sort of introverted. And when you do this to them, they can smile, their whole life changes. I had a patient the other day who I placed implants on, and very happy, was able to eat, but their front teeth were also affected. So we went ahead and capped their teeth and gave him beautiful smile teeth. About just recently, he sends me he tells me, Dr. Miller, I'm 72 years old and I'm dating someone who's like 40. And the first compliment I got was that I have a beautiful smile. And he was so happy to hear that, and I was very happy to hear that. But again, it wasn't I who changed his life. He had the courage to pick up the phone and come to me.
Because nobody likes going to the dentist, right?
No, nobody
do you
likes-
still hear that? Like, hey, they say, look, no offense, but I don't like the dentist. Do you ever hear that? Do they say
I
that?
hear that all the time. I hear that all the time.
What is your goal secretly? Like to win them over? Like when you hear that?
Yes, that is my goal, to win them over by being kind and give them, to listen to their story and see what options we can give and win them with trust.
So if somebody goes to you and they're of the two categories, they either have really, really bad teeth that may have to all be removed or they're currently wearing a denture. What are their options when it comes to dental implants in your practice?
So let's talk about the options.
Okay.
Both of them have pretty much the same options. So we can start off with some patients, they may only be able to have 2 implants, but they can have a whole arch of teeth that will snap in and snap out and comfortable, and they can eat.
So they get a full arch of teeth on 2 implants that snap in, snap out.
Correct.
What's the next level up?
Well, the next level up would be to do 4 sets of implants, 4 implants with a full arch of teeth. And what's nice about that is that set of teeth won't wobble as much, and it's more supported by the implants.
So they don't have to. What about adhesive? They could no more adhesive.
They don't need to have any adhesive in their mouth anymore. And then, if we went with 6 implants on the lower, you can have a full arch of teeth that you never have to take out of your mouth. And on the upper,
that seems like what everybody would want, right?
Of course, I mean, there are a lot of people who don't want to take snap in and snap out of their teeth. And on the upper arch, we could do the same thing. We can do 4 implants which snap in and snap out teeth, or give them 6 or 8 implants and give them a full arch of teeth that they never have to take out.
So when it's all done, they get their new teeth. How soon can they eat?
Well, initially, they can eat soft foods for a few weeks, but before you can know it, they can be out to dinner eating steak at Mitch's or pizza at Cheesecake Factory or California Pizza Kitchen or your favorite restaurant, wherever you want to go.
Are they ever worried about eating? Like they say, hey, Dr. Miller, are you sure I could eat like a steak? Or are they ever afraid at the beginning?
You can eat whatever a normal person would eat with a full arch of teeth, natural teeth. With your new teeth, you know how you can, initially you struggled eating salad, biting into a banana, eating chocolate cake, thinking that it's all going to get sticky on your dentures. You don't have that anymore. You could get to eat salad, you can eat cucumbers, carrots, celery, all chopped up in a salad.
Okay. What do they like more? What do they like more? The way it looks or the foods they could eat?
That's an interesting question. So I had a patient, all they cared about was a beautiful smile.
Okay.
But then, about 6 months later, they came to me and said, not only do I have a beautiful smile, I can eat whatever I want. And that was great. Then I had another patient, all they cared about was able to eat a steak. And they wanted to be able to eat beef jerky.
Okay.
But then 3 months later, they came to me and said, well, doc, I can smile. And everyone's complimenting me on my smile and how great I look. So to answer your question, I think it's a combination of the two.
So you see people transform. Like
Yes.
I was saying respectfully, it's just teeth. And you say it's much more than that. But you literally see when they come in for checkups
Yes.
or maintenance, they're different.
Absolute. So it's not just about teeth. You see their lives transform. Their lifestyle is different. They're happy. They feel so good about themselves. They smile more. And that's the greatest satisfaction you can do.
Is it ever hard for even you to recognize them because they're acting differently? Are they
Well,
dressed differently?
yes, initially it is a surprise for me. And then it gives me a really, really happiness in my heart, the fact that they have actually transformed their lives.
I think you even told me this on the phone, that you get the wrong impression about people. They come in one way before they have their new teeth, and then after it's done, you didn't realize that they're very outgoing and self-confident.
Absolutely. I mean, they come in very insecure, uncertain, not knowing exactly how this is going to work out. And then once they're done, wow, it's like, here's a totally different person looking, they may be in their 60s, looking like they are in their 40s. Some of them, like I said, my dear patient who's 92, she looks like she's 60 and smiling.
I would say so. I saw the photo.
Yes. And so, yes, it certainly transforms their life and their lifestyle. The quality of life has definitely changed. And I think that's fully worth whatever they spent. And again, I emphasize, they took the time to pick up the phone and call. So I give them the credit.
Hardest part.
That is the hardest part.
Now you brought another photo. What are we looking at over there?
Yes, so here's a story of another gentleman. He absolutely didn't want a traditional denture. So what was his option? We gave him a full arch of teeth that snapped in and snapped out, and he left with implants in his jaw, a full arch of teeth, smiling.
This is him. He's looking pretty good.
Yes, and in fact, initially, he didn't know how to smile because he had never smiled for a long time. So he literally had to train himself to smile.
Yeah, it kind of looks like he's forcing a smile.
Yes.
That goes away over time?
It goes away over time because the reality hits that now he has a full arch of teeth. You have a full arch of teeth. You can smile, you can eat, you can really be yourself.
What's it like when they look at their self in the mirror for the first time?
The joy on their face is a lasting memory that you'll always have.
Is that right?
Yes.
Did they, and did they ever, by the way, do people come in like husbands, wives, partners? Does like one go in first, like the guinea pig, and then the next one comes in? Have you ever done husbands?
Yes,
and
I
wives
have done
or
partners. I have done husbands and wives. One comes in first.
They get it done.
They get it done, and then the other one may not need a full arch of teeth. They may need some crowns, or they may need maybe 1 or 2 implants, and they get them done. And some of them, I have a husband and wife. The husband needed a full arch of teeth, a full mouth reconstruction. The wife had beautiful teeth. She had gorgeous teeth. She literally only needed a few fillings and a regular cleaning. And I complimented her. She's in her 70s, but she looks like she's in her 40s, and she has the most gorgeous natural teeth. But I was able to get her husband to smile and look as handsome and nice. So when they go out, now he can chew and eat and smile and have a great life. Before, his teeth were terrible. And mind you, he was a doctor. And he was so busy working that he didn't have time to take care of his teeth.
Now you say in your practice you don't judge them on their bad teeth.
We never tell them how bad their teeth are. We are here to help them.
Okay.
We are here to serve you. We just accept you for what it is, then we give you your options, and we go from there. And we always talk about how good it's going to be.
Now, what about people that have like gum disease or the periodontal disease, bad gums? Can they do this?
Well, that's who is coming in. The majority of my patients have bad gum disease. And what does that mean? They have teeth. Maybe they don't have any cavities. They have a couple of crowns in their mouth. But under their teeth, in the gum and in the bone, is where they have the infection. And sometimes they don't even have any pain. But that is where the problem is arising. So majority of my patients come to me with
bad gums.
With bad infected gums.
So you clean that up.
We clean
and
that
then you're
up.
able to give them new teeth.
And then we give them a full arch of teeth. And some of them we save their teeth as we can. Some of those teeth could be saved. So I'm not saying that every patient who comes into our office, we pull all your teeth out. Some of them we do everything we can, and if we can, to save your teeth. And then the rest we replace with implants and a full arch of teeth, and you leave smiling.
And it can be that. Now, let's go over the process. So, and I asked you actually in the green room. So they get to meet you, get to know each other a little bit, their history, etc. You go over the options. If they decide to move forward, what happens next?
Okay.
In a perfect world, if everything goes right.
So
let's say they're in their 70s and they've decided they're going to do it. Take me through that process before they get into that, fixed set of upper and lower teeth.
So there are 3 steps. The first step is to get to know the patient, understand their concerns, what is it they want. Once they decide to be a patient and they want to move forward, the second appointment, then we go into more detail. If you're a male or female, we look at the teeth, the shape of your teeth, the color of your teeth, the smile design, what options you have. We show you different options, and then we go over the...
So, do they kind of know what their teeth are going to look like? Like, do
yes,
they get to pick the color or...
during the process, initially we show them options they can have.
Okay.
And then after the surgery as well, they can fine-tune those colors. As we fine-tune those colors as well. So in that design, it's sort of a work of art. We try to customize your teeth. We try to listen to what you would like to see your teeth look like. We have men who have dense white teeth. Women generally have white teeth, but there are more light goes through them. So we customize those. Some people like pointy canines. Some people like rounded canines. So all that is taken into consideration before we give you the final.
Okay. So they say, I love that smile.
Yes.
Then the next trip is what? That's when they get their teeth?
Yes. So the third appointment is when the surgery is done. And on that day, they get their set of teeth. And they get their new set of teeth, their full arch teeth. Sometimes it may be temporary. Most of the time it's temporary, but it's way better than...
Like they get a temporary set of teeth, and then then they get their...
And then once the bone is healed and things are done, shortly after that, they get their permanent set of teeth. And so it's a great process, and it has changed their lives.
Now, and we're short on time, but we need to bring up,
Financing.
Dental insurance doesn't really cover this. Medicare, Medicaid doesn't cover this, but I guess more and more people are financing.
Yes, so I have patients who have insurance, but insurance is limited, and so Medicare doesn't cover it, Medi-Cal or Medicaid doesn't cover it. So there is independent financing over 5 years. Some patients do it over 5 years, some over 3 years, some over 2 years. So there are different options, and some of them have savings, and some pay cash up front and get it done. But at the end of the day, it has changed their lives because of the decision they made to come to me.
We're out of time. So let's say a patient is one of the two categories. They either have really bad teeth and gums, or they're wearing a denture. And they've heard what you have to say, but they're still skeptical. What do you say to them?
Just come in. Let me know your concerns. Tell me what's bothering you, and let's see if we can help you. All it takes, it doesn't hurt you, just come in.
Just get your options.
Just get your options.
All right. Well, look, and they always get to see you on the consults?
Absolutely.
You're a positive person. I'm not trying to side with you, but even on the phone, my first impression, very positive. Dr. Miller, I want to thank you for coming to the show. Great stuff.
Thank you, Randy. Great being on the show.
Should they go to the website, make an appointment there, or just call your office?
Call my office, and definitely visit my website, and just call my office, and Shelley will be very happy to hear from you and talk to you and answer any more questions that you may have.
Okay, good. Thanks again. Appreciate it. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.